Our facilities are figuratively on fire. I'm an emergency room physician trying to protect my community. I'm here to warn you, our emergency departments are in shambles. If you think what you saw happen with the airlines this holiday season was awful, the same thing is happening in hospitals all across the country right now.
An individual with the TikTok handle Dr. Fed Up AF has gone viral with a single video discussing our broken healthcare system in relation to the late-stage capitalism our country finds itself in. Now, this person has gone to clearly great lengths to remain anonymous, so we can't verify if they actually are a licensed doctor, as they claim to be, but nonetheless, the points they raise in this video are worth discussing. Our healthcare system has been broken, like most other systems in this country, by greed. It does not function the way it's supposed to. It does not serve the people it is intended to serve. Like other things, it's been co-opted by the rich in order to make themselves richer. And as much can be said by this anonymous doctor, so let's watch the rest of the clip.
The businessmen that have taken over our hospitals keep lining their pockets by making cuts to the resources that is provided to our families and our communities. They won't stop unless we call them out and make them stop. I'm going to keep posting the details so that you are aware, because they're trying to hide the truth from you. They're stealing from you. They're stealing from your health care. They're stealing from your health to get richer. I'm not going to stop, and neither should you. We need to demand better.
Receiving emergency health care because of an accident or an emergency illness should not bankrupt a person. People every day have their lives ruined because their insurance didn't cover the specific type of emergency health care that they needed. And even when you try to do the right thing and be responsible, make sure that the services you receive at the ER are covered by your insurance before you receive them, or the doctors you see are covered by your insurance before you see them, it still doesn't go right.
I recently went to the emergency room because I had dengue fever and it was really bad. Mind you, before I came into the hospital at all, I asked if they accepted my insurance, and the receptionist said that they did accept my insurance. So anyway, the registration nurse comes in and she gives me this piece of paper, and basically what the paper says is that the doctors or the anesthesiologist or anybody else that treats you are not employed by the hospital. They are private practitioners, and also that they may or may not participate in your insurance.
Do you want to sign or not? I'm not, because Nancy spent an hour and a half with you, so yes or no?
Okay, but I understand it's difficult, but I just need somebody to tell me.
I can't tell you.
You can't tell me if you accept Cigna or
No,
not?
that's billing. That's not me.
Is there somebody I can talk to?
I don't know.
As a patient trying to receive emergency medical care in the ER, he has no idea if this will bankrupt him or not, ruin his life or not. And this is not an outlier of a story. If you search broken healthcare system on any social media platform, you will find a staggering number of depressing stories just like this one, and worse. Hospitals are understaffed and the workers are underpaid whilst working at least 5 people's jobs at a time, leading to overpriced, under-quality healthcare, and the nurses are speaking out.
We're standing up for patient safety and advocating for patient rights and nurse rights in our hospital. We have 500 vacancies in a hospital of 3,000 nurses, and that's not enough to take care of the amount of patients we have. Because our patients are not being cared for the way they need to be cared for, the way they deserve to be cared for, and we are risking our license and we're risking patient lives to work like this, and that's not acceptable. And so we're advocating for nurse ratios, staff ratios, which helps prevent a nurse from having 8, 9, 10 patients, which is insane.
Now, this Dr. Fed Up AF did come out with a second video. There are only 2 videos so far. It's a call to action, asking people to write the hospital administrators, to write the members of government, asking for change. And it's also a promise that this person will be spilling hospital secrets in videos moving forward.
I'm going to give you specific examples I've seen or heard. You deserve to know what's happening.
Now, whether or not this is going to give us something that the nurses on strike who aren't anonymous aren't already giving us, I'm not sure. But for now, at least we know that the healthcare workers are speaking out. They're fed up. The system doesn't work for them. The system doesn't work for us. The system only works for the people profiting off of it. And that's not sustainable. It can't work like that forever. Thank you so much for watching. If you got something out of this video, please like and share it. Consider subscribing to The Breakdown on YouTube to get more videos like these, and I will see you in the next video. Thank you.